And we are back. So I was able to save the video at 45 minutes, and I was able to save the video to IG stories, and it's saved in my gallery. Hey Lana. So hey Amory. So I'm gonna post on YouTube, and I put it up on my IGTV. I don't know how guys don't know where IGTV is, guys. I don't know. Just Google it. Google how to find IGTV. Let me take a little drink of my little soda here, guys. I know it's bad for me, but I have a weakness for orange and grape soda. So, now that I have found the sweet spot in saving the video, I'm going to start putting them up on YouTube, and maybe we can do lives more often and put it up there on YouTube. I'm not good with social media. I'm a little okay, but when it comes to like social media marketing, that's what I need some a little help on. So when I get time, I'll be doing my little research in that, and these internet gurus, what they say to do, and blah blah blah, whatever. All right, so we were going to talk about Eusebio, we were going to talk about Cabral, we're going to talk about Surgical Sisters. Who got the tea on them? I want to know who they are, where they're from, whatever. The designer bodies. You guys were saying that the lady is big in Jamaica. She used the dancehall queens and whatever else to advertise her business and stuff. I'm going to talk a little bit about what I want to do for you guys on the Surgery Bay platform. Because here's my logic or my way of thinking, right? I know how plastic surgery has made me feel since I've had my surgery, my outward appearance, how I'm looking mentally, big part mentally, how it has changed my life, how much happier I am, how differently I react to certain situations now when it comes to, I don't know, whatever. Okay, like let me give you guys an example. I was in the bathroom today at the truck stop. I was brushing my teeth and stuff, whatever. And this little thing I'm wearing, it's like a romper. Where it has a big cutoff on the side. It's like a little top underneath here. So it's a spandex, it's tight and fitted, whatever. And into the bathroom comes this white lady, right? She's fat. I'm not gonna lie. She's fat. She had a big belly in front of her. She wasn't pregnant. She just was fat. Had a big belly. She went to use the bathroom, whatever, and then she come outside to wash her hands, and she's standing next to me, and then she's like this. And that was what she said. I was like, in my mind, I didn't twist up my face like that, but in my mind I was like, bitch, what? But I'm telling you guys, before, the old me would have been like, what the fuck you looking at? That's what I would have said to her. But now the new me is like, you know what, Roberta? Other women will look at you and twist up their face, say stuff, whatever, watch you some kind of way, whatever, because whether it's jealousy, whether it's whatever emotion that they're feeling, and I understand that that's part of the surgery game or whatever, that this is the reaction you get from people now. Not just men hooting and hollering and staring and saying things to you and whatever. But also women start behaving a certain kind of way towards you, including your own damn friends and family. And I've experienced that too with people that I know, friends of mine. So, excuse me. So, that would have been the old Roberta. But the new Roberta is like, all right, just chill, She just, But instead of me telling her, listen, ma'am, I can help you with, here's my Instagram page. Go to Surgery Bay. I was like, you know what? Just don't tell this lady nothing. Because then she might tell you, oh, so you think I need plastic surgery? So my point is, being that all that I've experienced and how I feel now with, after having my plastic surgery and stuff, I want other people to experience that too. I want other people to have that same joy, to have that same happiness, to have that. It trickles down. It trickles down in your life, not just, from you, but to other people, to your friends, your family, strangers, how you treat people, whatever. It trickles down. And the thing I wanted to do this year, 2020, and then COVID fucked up all of that shit, was I wanted to liaise with all these different people in the Dominican Republic who's doing plastic surgery And then I showed you guys all these different surgeons in that post I made, was it yesterday? And there's a lot of doctors out there that I've been looking at their pages, and I'm like, wait, these doctors are doing a really nice work. And why are they not more popular? Why are they not more famous? And I'm pretty sure that they... Okay, sorry about that, guys. I'm in Arizona, so I'm about to go into New Mexico. I hope signal continues being good so we can continue the live. So I'm pretty sure that some of these doctors that are doing nice work and they're there in the DR and they're not popular are charging a cheaper price. Like one lady who lives in my area in Florida, she went down there. I think she's Dominican. Anyway, I know she's Spanish for sure. She went down there to the DR and she met with this one doctor, and he's not really that famous. He's kind of so-so. He's known in the surgery world, but he's not super famous. Anyway, she was telling me that he was giving her prices somewhere along the lines of doing like breast implants for like $2,000. This is something that if you go just for breast surgery only, not as an add-on to your tummy tuck or whatever, but just breast surgery only, I believe the price, if I'm not mistaken, is like $4,000. You know, so there's doctors out there that will give cheaper prices that are gonna do nice work. Okay, they may not be the Cabral, Mr. Snatch King of all. You're gonna be out there looking like Bernice Burgos, but from where you started to how you look now, it's definitely gonna be a big ass improvement. So my thing I want to do for people who follow the Surgery Bay platform, people who are interested in having surgery but they cannot afford to pay $10,000, $8,000 or whatever for surgery, for a package, whatever. I want to find these people that are offering better prices, cheaper prices, and they still have quality behind their work, whether it's the recovery house, whether it's a driver, whether it's a masseuse, whatever, so that when you guys say, okay, Surgery Bay, the same thing that these other coordinators are doing, except my thing is I don't want to keep people eye out. I want to be able to make it affordable where everybody could have their dream come true of a better body and a surgery body, or just bettering, their looks, whatever it is that they want to fix and change, amongst themselves. So things like the Faja, like somebody was telling me, they are working with, I don't know the guy, I guess maybe he gets them, he imports them from Colombia or whatever, that he's willing to sell them the Faja for a lot cheaper price than what you would pay for it at the Faja store. It's the Colombian, Faja with the 3-row hooks and whatever. So that's what I wanted to do for 2020, and then COVID came and fucked up all my shit, whatever. But God willing, December when I go to the DR, I can do this. That's why I'm going down there for probably 4 weeks or more, so that I can meet all these different people and get all these different things together, and then tell people, okay, if you want to do a Surgery Bay package, whatever, these are the doctors, because I ain't hiding shit from you all. These are the doctors that I'm offering. This is their work. This is what they're willing to charge you for the package, whatever. Everything would be included, meaning all your surgery supplies, your boppy pillow, your ab board, your backboard, whatever. You ain't got to come down there talk about, I got to pay the masseuse, I got to pay the driver. Everything would be included. Everybody would be paid. The only thing you have to come with is your clothes and your passport. That's it. I don't want it to be where people come down there and they have to be, well, I didn't know this wasn't included because I thought you guys were going to give. No, I want it to be that everything is included. Everything. Whether it's, like I said, all your supplies, all your post-op care, your post-op supplies, whatever, your driver, and I'm not talking about just to take you to the doctor and back to the recovery house. I'm talking about if you want to go, let's say we say, okay, you're down there for 12 days or 15 days, whatever, and you want to go to whatever excursion, dinner one night, to the mall one day, to the movies one day, like some of these extracurricular activities, whatever, is what I want to have it planned where you would have a choice. Okay, you're going to get 2 excursions, let's say one before your surgery and one after your surgery when you're feeling better and you're able to walk around, whatever. Where do you want to go? You want to go to the movies? You want to go to, and the movies in the DR there are movie theaters that have the movie in English, so that's my whole thing about when we were talking earlier about designer bodies and charging you all this money and then you're not getting a bunch of shit for it. Like, I don't like that. Like, I feel like if you have to pay all this money, you should get some enjoyment out of the entire surgery journey. So Surgery Sisters now, and I'm gonna post it in there for you guys to see the conversation I had with the young lady, and she has to go back for another round, so now she knows. And it warms my heart when I hear you guys say things like this to me. I wish I had found your page before I did this. Like, she found my page after she already paid them all this money, whatever. Anyway, so she paid them, she said 10,000 and something, so it was almost $11,000. And then she paid another $1,000 for her sister to come and stay with her 5 days. So they're charging $200 a day for her sister to be there with her, and all the sister is doing is getting food and a bed. $200 a day. Do you guys know what John charges, Butterfly Recovery House charges, for your companion to come and stay with you in the double room per day? And the transportation to pick you up from the airport and whatever is included. What the doll is paying, the companion is included in that transportation, because there's one driver with a car. You could fit 3-4 people in there. You know what I'm saying? You don't have to be per person gotta pay the transportation fee. No. John, Butterfly Recovery House, John charges $40 a day for the companion for the double room. And you're getting in there, the companion, is getting their transportation included, their food and snacks, and the room for them to stay in with you. Yeah. And Designer Bodies Surgical Sisters charge this woman $200 a day, $1,000 for 5 days for her sister to come and stay with her. So she's telling me in the post, oh my God, guys, there's so much. It's fucked up. That's really what it is. This lady, first of all, did she have a tummy tuck? Or I think she only had fucking 360 lipo and BBL, which is $3,500. And like I said to you all earlier, these doctors are giving these people a cheaper price. They're not paying the price that we're paying. And BBL lipo, 360 lipo and BBL is $3,500 is the price we would pay. So I'm sure they're getting it for cheaper, because she said it was called the Vixen package or some shit like that. And I believe it was only 360 lipo BBL. I don't believe she had no tummy tuck. The faja that she got, they tried to say they tried to tell her Alexander. We all know Alexander is the fucking best in regards to getting your faja altered, getting a faja done by him, whatever. They brought this faja to her and told her that Alexander altered this faja. The nurse called Alexander and said, "This is your faja," and he started cussing. Let me tell you how this person, whoever the fuck they took the faja to. First of all, when Alexander do your faja is smooth. Like, there is no loose thread, there is no ugly looking whatever. Your faja look like it came like that. It doesn't even look like it was altered. This faja that they gave the woman, I'm telling about Alexander did her faja, have a big old piece of bright yellow thread that did the stitching, and a long piece of loose thread hanging out the end. So she was like, wait, what? Nah, you all got to take this back. So just going into the same thing like Designer Bodies, Surgical Sisters are charging these ridiculous ass prices. She said she had to still pay the driver the extracurricular stuff that they talk about. We're going to take you on whatever excursion, outing, whatever. The woman who is supposed to come and take her out or around or whatever would come every day in the afternoon when the day is over. So like, what kind of extracurricular activity you going to take somebody at that time of the day, you know? Then she was saying when she got there, she didn't even know who to contact. She's in the airport and don't even know who the driver is, who's picking her up, where to go, nothing like that. Like, how do you do business like that? That your people who are coming into the country have no idea who the hell to look for when they land in the airport, and they're out there like Boo-Boo the Fool, looking around like... You know what I'm saying, guys? This woman paid almost $12,000 to Surgical Sister, and then had to spend all this other money to buy Boppy pillow and pay the driver and all kind of other shit. And then whoever it is that is supposed to be meeting her to take her to the house or introduce her to the program or whatever, didn't even come until like the second day or something like that after. Like, you're there not knowing what the hell going on. Then last minute, they change her doctor. Oh, sorry. They do the same shit that designer bodies do. They tell them, oh no, the doctors are so popular and famous that's why we don't give the name, because then they will get overbooked. That's the excuse that they give, that they're telling her. So now she go down there, was supposed to have surgery with one doctor, then they tell her the day before surgery, after she already did whatever testing, oh no, we have to change doctors to this other doctor. Whoever the other doctor is now, and I don't even know who the doctor is, needed more tests done than what she did with the other doctor, and she had to go and get more tests now. So at this point, she's in the DR for almost a week with no surgery. Let me read you guys' comments. Give me 1 second, guys. I don't know who's Claudio. What happened to Claudio? I have no idea who's Claudio. Could you stay in the DR for 2 weeks if you get a tummy tuck? You can stay as long as you want. My 2 surgeries, I stayed 3 weeks the first one and 2.5 weeks the second one. The longer you stay and the more massages you get, guys, honestly, I think it's really the best if you want to come back home and then don't have to worry about, okay, I have all this fluid, I'm going to get infection, crazy shit going to happen. Why do they make us stay at least 14 days and not leave sooner? I honestly don't know why they're telling you 14 days and not sooner. I mean, they're not holding you hostage. You can leave if you want, but just know that the doctor will tell you if you leave before his recommendation, or if something happened to you, he's not liable. But they can't make you stay there if you don't want to. The both times I've traveled, the release letter that I get from my doctor, in the airport, nobody asked me for that, both times. So, you know, it's not like a mandatory thing or whatever, but again, depending on the procedure you get done, they want you to stay down there and get your massages and so forth, because they know that the care you're going to get in the DR in regards to surgical care is not going to be more than likely the same you're going to get wherever you live when you go back, you know, to them. So I want to say that's probably why they tell you to stay. And then too, if something happened to you, what if you get a blood clot? You're susceptible to getting blood clots and stuff up until a month or more post-op, you know. So that's why they always tell you about your heparin shots and wearing your stockings, your compression socks and stuff, you know, to help prevent something like that from happening. So that's why I think that they want you to stay down there, because just in case something happened to you, whatever, they can help take care of it and fix the situation if something happened. He took good care of me. I don't know who Claudio is, honey. Who is this Claudio? What does he do? I will definitely always heard such good things about him. Alright. I guess you all know who Claudio is. Alright. Yeah, they did that. They did her really dirty. And that's sad that she gotta come back and do a round 2, you know, because she's not happy with... Oh, I know who it is. She went to Ferreira's. That's who did her surgery. That's how the conversation started. That's who did her surgery. So she's saying that she feel like Ferreira's could have given her a big butt, and he didn't. So she's going to go back for round 2 to get a revision. The way my temper is set up, I'll be recovering in the Dominican jail cell. That's me too. Like, I fly off the handle when I see shit that I don't like either. Like, my temper is one thing that is a work in progress my whole life. And when he'll come back and whoop somebody's ass. People can't disrespect people's money like that. Yeah, that when I saw a story, I was like, wait, what? Tell me more. Tell me what happened, because I want to share your story with people. I go to the islands and be ready to stay permanently. Corona time, so you have to stay extra to do the tests. Yeah. Okay, so Claudio is a masseuse. Send me his page, because I have never heard that name in my life. Honestly, I have never heard of Claudio. I've heard of course, John, Oz, Edison, Massage Francis. Who else? Magic Hands, Yenny, that lady Fendi. I ain't recommending her to you all at all. but I've never heard of this Claudia person. Okay, so Eusebio and Cabral we were talking about. My body looks so much worse compared to... What the hell you mean? Who was your doctor for you to say your body looks worse compared to Priya? Okay, let's talk about Eusebio. But guys, I'm going to post a conversation I had with a young lady about Surgical Sisters on my feed, so you guys can go and see it. What she said in her words, what she went through, what she had to pay for extra after spending all of that money. And they keep telling her, oh, I'm going to give you a refund, but they definitely didn't. 3 months later, she's waiting, still no refund. I can't believe you never heard of Claudio. Like a year ago, he was one of the most popular masseuses. I have never heard of that man. I swear to you all. Since 2017, when I started doing research for surgery, I've never heard his name called in a Facebook group or anything like that. Okay, alright, so Eusebio. So this is what I've gathered from looking at his work and talking to people down there in the DR about him and so forth. His dad is a doctor as well. I think his father is a gynecologist. He works at a Cipla. He has been, I don't know how long he's been a plastic surgeon per se, because you know you gotta specialize and all of that. But it's been about 15 years or more since he's been to medical school. So he's been, let's say, an MD before he specialized for a good couple of years. Now, his specialty, what I concluded, I have not seen him work on big girls like Mannion or Laurent or Patrick St. Louis or Mercedes or Mora. I have not seen him work on big girls like that. But I've seen him work on, let's say, medium girls, slim girls. His Vesa lipo game is on point. Like between him and Mejia is a toss-up. It's really a toss-up. But after speaking to more than one Mejia doll, it seems that Mejia is not aggressive, and that's what I want. Oh, look. Nurse Tejada said, even I want to know who is Claudio. That's what I'm saying. Alta Garcia, who is this man that somebody saying is a year ago is the best in the DR? We never heard about this man. Is he rating up himself? I'm telling you all, he's the number one masseuse king in the DR. Alright, so anyway, so I want to say for me, Eusebio would be working on, like, let's say Duran type girls, 32 and less BMI, that he would do a really good job with that liposculpting. Looking at his Vesa work, I was so in freaking love. And actually, how I got put on to him was when I was inquiring about Disla. That's when I was told, have you looked at Eusebio's work? And I followed him from before, but I never really went and looked at all his pictures on his page, all his, highlights and stuff. I did not. So when I went, I was like, wait, what? So the person was telling me, they were like, yeah, I think he would really do a good job on your husband, especially fixing that fibrosis that he got in his belly. So when I looked at it, whatever, I was like, all right, I like what I'm seeing. Then I WhatsApp him because he has his number in, in his profile. I was so pleasantly surprised to see it was him answering me in WhatsApp. Now, you all know, if I gotta go through some damn assistant and coordinator, whatever, automatically the doctor gets crossed out my fucking book, because these coordinators, whatever, you and the doctor, you are regular Joe like me, okay? You are not a physician assistant or whatever you want to call it, to say that you can tell me, okay, well, I recommend this procedure for you and that procedure. No, you're not even showing the doctor my freaking work. You're just saying, I think you should do this, and that's going to be the price. So I don't deal with them damn coordinator, assistant people good at all. I want to talk to the doctor myself, because I want him or her to evaluate my pictures, my video, whatever, and tell me, yeah, this is what I want to do to you. And that's what Eusebio did. So I was talking to him, well, when we were talking on WhatsApp, and he was telling me what he recommends, the things I want done, and what he would recommend. So I said to him, I don't want to do an arm lift. I want to do arm lipo. And the reason why I want to do arm lipo is because, one, with the arm lift, you have this big ass ugly scar, and it's such a sensitive part of your body that if you are not careful, those incisions are going to pop open, split open, heal, yucky, whatever, different things like that. So he said to me, he said, yes, the VESA lipo will work for your arms, but there is going to be some loose skin, and I want to do a partial lift on you. So I said, okay, the partial lift, if it's going to be that you can do the incision under my armpit, where it can be hidden and it's not going to be a big, yucky scar, or issues where I got to deal with this for a good 2 months for it to heal and whatever, I'm okay with a small scar being under my armpit. And he said, yes, I can do it like that for you if that's how you want it. And then, talking about like a little bit of loose skin that I have on my waist, on my back, down by my waist, that I don't like, I said to him, okay, so how are we going to tackle that? He thinks that the VESA lipo, once I do the VESA lipo, is going to retract that skin on my back where I would not even need a back lift. And that's one of the things that Mejia coordinator, not Mejia, wanted to do. And also Mercedes assistant Susan, Miss Tummy Tuck. She is talking about I should do that as well and come back for arms and a back lift and whatever. So talking to him and hearing the plan that he have, the vision that he saw for my body and how he wants to tackle it, that really, hey personal driver, that really put me on to, okay, I like what he's seeing, what he's envisioning, and how his plan of action is going to be. Because this round that I'm going to be having, I don't have a lot of fat for them to lipo out of me to like fix that dent that I have on the sides of my butt as well. I don't have too much fat for them to do, much fat transfer with me. So this round is going to be really all about sculpting. It's not going to be about, okay, I have, tummy tuck is a big procedure. You're cutting out a big chunk of skin. My breasts I want to get reduced more because they got back a little bigger. And I really wanted, honestly, a BC cup, and I freaking have double Ds. I went from triple D to D with the surgery, and now I'm back to double D. So I'm like, initially I told Lawrence I wanted a BC, I wanted small breasts. He gave me D. So D went back to double D. But anyway, so I want to get with Dr. Eusebio the arm lipo lift, small mini lift, if you will. Breast reduction. I am seriously contemplating breast implants because I want them to stay perky. Yes, it's vanity, I know. My husband is not too keen about that. I'm not too keen about it either. But, will vanity win over sensibility? I don't know. So I need to do my research on Motiva implants because that's the implants that they use in the DR. 360 lipo, BBL. And then the 360 lipo, I don't know if he will do, I need to talk to him about that, a mini tummy tuck just to get rid of the loose skin in the fupa area when he does the 360 lipo. Or if the VESA will tighten it up where I don't even have to get rid of that bit of that little bit of skin that's going to be above there in the fupa area. So that's kind of like the plan right now. The tummy tuck scar revision, since that would be considered a major surgery and I would not be able to get my breast done if I do that, I'm going to put that off to possibly go back for round 4 to do that and any other little touch up that I may need. But this third round for me is really going to be about liposculpting. So let me answer you guys questions, and then we're going to jump into some of those posts that I made in the last day or two. All right, so you're all talking about this Claudio man that nobody know about but you, Bayesdal. Well, he was one of the most popular. Why is he not popular if he was popular? What happened now? What do you think about Ferreras? So I find Ferreras, and I think it depends on your foundation too with Ferreras. I think he does nice work. The dollar that went to him through Surgery Sisters, well, she wasn't happy with how her butt turned out. But looking, and of course, doctors, we all know, post the best pictures of their clients and videos, right? Looking at his work, and like I say, it depends on your foundation. I think he's in the same bracket as what do you call it, Mercedes, Mejia, Mora, these guys. You know, I don't think he's a bad doctor, and I've never really heard anybody saying that they got an infection or they got burnt or something like that with Ferreras. Did you miss the tea? I don't know, honey, but it's gonna go on YouTube. The what do you call it? The live. When I'm done, I'm gonna put it on YouTube. You went to Malal for your round one? Oh Lord, how was that experience? All right. Eusebio, okay. I need a tea on Ferreras. I'm really leaning towards him for my round two. So there's no tea on Ferreras. Ferreras, which I like about him, he's also a family man, and I'm big on these doctors that you see that they have morals and values, you know. I'm big on that, which is why the senior is an asshole in my book. Like, he can't even fucking work on a damn dead fucking bird on the side of the road for me. Like, y'all who are the senior fans need to go and ask him what happened with his wife and his marriage and all his damn children and where are they now. In fact, go to the highlight. Go to the highlight. You're gonna see his wife's name in the highlight on Facebook, commenting and saying that him and Tandra started having an affair in August when he opened that office in Cipla, and she didn't find out until January. You'll see her name there. She's on Facebook because I looked her up. She is there, and you can message her and ask her the truth about what kind of man she was married to. Basically, gave up his family for money. And you think I would want somebody like that working on me? That means my life ain't worth shit to you. Yeah, when you guys get a breast lift, guys, your breast is gonna droop back some. It's not gonna stay perky like it looks right out of surgery because it's swollen, so it's all perky and looking like you got implants in there. But at about 2 months, when the swelling goes down, you are gonna get some droop. And if you gain weight, your boobs are gonna get back bigger because your breast is made out of fat, you know, fatty tissue. What is VESA? That is on my feed. You can go and look it up and you will get an explanation. You were cooking? No, we weren't talking about good breast doctors. But they always say Disla is the queen of the boobs in the DR. That's what they say about her. What kind of implants did you say they use in the DR? Motiva. Motiva. Hey Allison, I didn't see you a long time, girl. What about the doctor that owns C-Slip? I never hear people talk about him. So, he's one of the doctors that I follow, and he's one of the doctors in that list that I put there. His name is it Jesus Abreu or something like that? I don't know why the hell this man, C-Slip owner, why is he not more famous or talked about in surgery circles? I don't know. Because he does really nice work. When I saw that, I was like, wait, what? Yeah, he does really, really nice work. But go look him up. Go look him up in the list of doctors that I follow. Go to my profile. Go and click on who I follow. Type in DR and you'll start seeing these doctors' names coming up. Well, VESA, Titan, skin alone, or do you need J-Plasma? So, J-Plasma is shit. Don't waste your money, that $2,500 on it. I put up a video also explaining why J-Plasma does not last. It only lasts for a little bit of time and then your skin goes back to being loose or flaccid or however it was before. VESA, yes, they say VESA does help tighten the skin more than traditional lipo, but J-Plasma and VESA are two completely different technologies. And with J-Plasma, in a nutshell, the more you use that area of your body, the more it's active. Think of it as a piece of elastic. The more you stretch it, sooner or later the elasticity is going to what is the word? No longer be elastic, so to speak. So you keep stretching something and then all the elasticity ends or stops or whatever. So that's what happens with J-Plasma. But the video is there for you to take a look at it on my feed, talking about why J-Plasma does not last. Is Tandra from the States? I seen in a Facebook group he wanted a green card. Yes, she's African American from Arkansas. If he wants a green card, well, hey, I guess he gonna get it. Because she ain't got no man as far as I understand. She got grown kids and she ain't got no man. Who do patients get burnt during lipo? Is that Dr. Carelessness or you mean why? Okay, so sometimes it depends on the doctor, it depends on your body, your health, and various reasons why you would get burned during lipo. So my husband, for round 1, he got 2 small lipo burns. They were maybe this big, yeah. And then for round 2, he did not get any lipo burns. Now, when I had surgery with Dr. Lorette, I didn't get any lipo burns either, and he was very aggressive on me. So here's the thing. There's different scenarios why you could get a lipo burn. Dr. Carelessness would mean things like the doctor, either he left the cannula sitting in one area, so the cannula now damaged the blood vessels so horribly that that area now will not get any blood and oxygen going to it, which essentially will then turn into a lipoburn / necrosis. Or the doctor is so aggressive with the lipo that he's trying to make you so super flat that he's lipoing certain areas over and over and over and over and taking out so much from you that same thing happens. That area now has no blood flow to it, and it will turn into necrosis / a lipoburn. The other aspect of that is, so it could be Dr. Carelessness by him being overly aggressive, not knowing when to stop. And the other part could be your health. So my husband, for round 1, he was diabetic. His blood glucose, I think if you're over 110, you're considered diabetic, and he was like in the 130s. So he was considered diabetic, and that made him susceptible to getting a lipoburn. And where he got the lipoburn was the hole that they make, the hole that they make with the scalpel to stick the cannula one, the neuter lipo. It's at the incision point is where he got the 2 lipoburns. So there are different things like pre-diabetic. If you may not be diabetic, but you may be pre-diabetic, or you're diabetic, or you have sickle cell anemia, or you have the anemia trait. You have like really dry, dehydrated skin. You know, you're not somebody who drinks a lot of water. You don't hydrate your body well. All of these are different reasons why you could get a lipoburn, and it's not necessarily the doctor's fault. So in my husband's case, his lipoburn that he had, being that it was only just the incision point, that would mean that because he's diabetic is why he got it. Now, if it was Dr. Carelessness, it would then be a big old whatever patch on you because the doctor lipoed that area so much and he killed all the blood vessels in that area, so you can't get any, blood flowing in that area. So then what happens? The skin turns black. You will know you have a lipoburn within 1 to 2 days. You will start seeing that lipoburn showing up. The skin is going to start going from whatever color you are to like a reddish brown color to like a purple color and then to black. And that's how you know the skin is dead. So people that have humongous lipoburns all over their belly, sides, back, whatever, and again, go to the highlight, the Dr. Desenia highlights. You're going to see in there examples of people that he's burnt so horribly. And I'm going to find out from the one girl who got her face burnt by him because he's doing face lipo on these people, to get her picture so I can post it so you guys can see. Those big ass lipoburns that he's sharing is 3rd degree lipoburns, 3rd degree burns. So people are taking months and months for those things to heal. And I can tell you, my husband had 2 little lipoburns like that, and that shit took 6 to 8 weeks to fully heal, where the skin, falls off, cracks off, whatever, peels off, and then the pink starts turning back brown to your skin complexion. It took almost 2 months for 2 little lipoburns to heal. So I can only imagine people with humongous lipoburns, how long that takes to heal. And then the lady with her face that got burnt. How are you even recovering from that? Like, do you have to now go and get all kind of scar treatment and different things like that because it's your face? You can't cover that with clothes and hide it, Oh, thank you, Cynthia. Yeah, guys, you guys know that I'm going to give it as it is. Who angry, who vexed, who mad? Oh well, what are you gonna do? Cuss me out on Facebook, on Instagram, try to insult me, whatever. That ain't taking away from my happiness or my life, my livelihood, my money, or me getting the rest of my surgery. So honestly, when you guys tell me, I don't know why they don't like you, Surgery Bay, that's why. Because I tell it as it is. I don't give a fuck. I am not going to sugarcoat shit for nobody. I'm not hiding nothing for nobody. I'm not easily bought by people. You know what I'm saying? I'm going to tell it as it is. Okay, Ravage Magic says, you post about fat absorption. Do you know how much saline liquid before lipo? All right. I'm going to come back and answer that because I want to end this live so that we can save it for YouTube. And when I do the 1 hour, it's not saving. So I'm almost like at 45 minutes again. So I'll answer that when I come back. The doctor let his girlfriend lipo in the DRK. Girl, I don't even talk about that. That's Tandra and Desenia. What exactly could you lipo on your face? Your chin. That's what people do. They go and get their chin lipoed. I did under here. Natalie Bello. Shady Natalie Bello. We're going to talk about that when I come back. I'm going to July 5th. I will be going to your page a lot when I am recovering. Thank you, honey. All right, so we're going to come back and talk about fat absorption, the saline solution that they put in you, Natalie Bello, and whatever other questions you guys have. So I will see you all in a minute.